conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. And we're taking your calls. What's that number, John?
800-848-9222. 800-848-9222.
So we're live. We're in the middle of New York City. It's crazy this week, right?
It is, yeah. The Super Bowl is certainly taking over the city.
Yeah, it's taking over the city, so it's a good reason to go home and sleep, right?
That's it. we didn't get the memo, Doc.
Well, why am I talking about sleep? Well, there's a new study coming out January 30th, so new news. That disrupted sleep might accelerate cancer growth. Wow.
Interesting.
What do you think about that?
I'm getting nervous. I should get back to bed.
So it was from January 30th, so that was 2 days ago. So it was a study published in Cancer Research, and they took two groups of mice. Do you know when mice sleep, by the way?
No idea.
Mice are nocturnal, which means they run around at night and they sleep all day.
Okay.
So I think they don't want us to see them.
Yeah, I think they adapted to the human condition.
Yeah, they've adapted to the human condition. They know we're up at daytime, so they sleep at night. So mice
smarter than we think.
Mice are nocturnal, if you didn't know that. Mice are nocturnal. They typically sleep in the daytime. So they took two groups of mice. One group of mice was allowed to sleep peacefully during the day, and one group had their sleep disrupted every 2 minutes with a motorized brush that swept through their cage. And then the mice were forced to wake up and go back to sleep. So it's not like a kind of torture.
Yeah, that seems pretty rough.
Okay.
Yeah.
Now, they did this for 7 days before being injected with cancer cells from two different kinds of cancer. So they either were normal sleep or disrupted sleep, and then they had injection of cancer cells. And then after injection, all the mice developed cancers within 9 to 12 days. And then 4 weeks later, researchers measured the cancer. Yeah. Okay? Good study. You like this?
I see where it's going.
Would you ever done that study?
Would I ever do it?
Yeah.
I think I would try to avoid being injected with cancer, but...
No, if you had mice, would you ask that question?
Yeah, sure.
So the results were that the mice whose sleep was disturbed had cancers twice as big as the ones who didn't have their sleep disturbed.
Wow.
Incredible, right?
Yeah.
And the culprit seems to be sleep's effects on the immune system, that well-rested mice had more immune cells called M1 cells, and the ones who had disrupted sleep had more immune cells called M2, which are known to hinder the immune system and promote cancers through growing blood vessels. So here's a study suggesting that sleep even helps limit the cancer growth. And lack of sleep tends to promote cancer growth.
So I guess there was some science behind my mother saying when you're sick, you need to rest.
So here it is.
Yeah.
Okay, here it is. Isn't it incredible?
Yeah.
Incredible study. So really interesting study, and hopefully people can take advantage of it, sleep a little extra, and then wake up early to listen to our show.
Yeah, that's right. Well rested.
Right? Well rested. We had hours and hours of sleep, right?
That's sure.
How about you? So another man I want to talk about just a few minutes is the man who heard us last week on the radio.
Okay.
And he came in.
Did he? Good.
Yeah, he came in. An interesting man. He had a pituitary tumor. Well, how did he know about it? Do you know about the pituitary gland?
You got to fill me in on this stuff.
John, I'm like teaching you anatomy.
I think I'm going to go. I think I'm going to get my PhD one of these days.
Yeah. So the pituitary is like the master gland.
Okay.
Without the pituitary, you wouldn't have your thyroid functioning. Your adrenal wouldn't function. Your testicles wouldn't function if you're a male. The ovaries wouldn't function if you're a female. And God, for some reason, put the pituitary next to the nerves that control vision.
Okay.
Okay, so there's a nerve that comes from your right eye and from your left eye, right?
Mm-hmm.
For your vision.
Sure.
And the nerves are they're like electrical wires,
Right.
sending impulses.
Sure.
Now, in the human body, the right nerve and the left nerve merge, and they go to something called the optic chiasm.
Okay.
Okay, so all a person's vision, all your vision goes through one spot. So you can say maybe that's not a good design because if you hit that one spot, you lose your vision. Right?
Right.
I mean, normally, you got a right lung and a left lung, and if something, God forbid, happens to your right lung, your left lung's okay, and the kidney, and we have like a duplicative system, so one supports the other and backs up. In vision, no. Everything goes through one spot.
Okay.
And this one spot is next to the pituitary. And this man started to lose his vision. He noticed vision problems. And he went to the doctor. He was found to have a tumor. This is called a benign tumor. Benign means it doesn't spread to other parts of the body.
Yeah, I've heard
So
lots
there's two
about
kinds
them,
of tumors. Cancerous tumors, which can spread, metastasis, and benign tumors. But benign tumors are not always so benign.
Yeah. Okay.
So he started losing vision. Now, there were two ways of surgically treating this man. He did not come to me for radiosurgery, because if he came to me, we would have offered him another option, and another option being non-invasive option. So he had surgery. He was offered one method through the mouth and another method through the head. So the surgeons chose to operate on the pituitary through the mouth.
Okay.
Now, the problem with that is when you go through the mouth, you can't see all of the tumor. Your vision is more limited.
Mm-hmm.
You don't know how much of the tumor is wrapped around the nerve for vision.
Right.
And so they removed this tumor through the mouth, and he ended up blind.
Oh, jeez.
And he went back to the doctors and said, why didn't you open up my head and do it from above so I wouldn't have gone blind? And they said, well, we didn't know if you wanted a scar on your head. Now, I don't know what he told his doctors, but yesterday he told me, Doc, a scar versus my vision?
Yeah.
A vision's
Apples
not
to oranges.
not replaceable.
Yeah,
A vision is unique. And in my department, he put his hand on my shoulder, and that's how he went from one point to another point. We helped him, and we're happy to help him, but it was so sad.
Yeah,
And
sure.
he was told, you lost your vision because we didn't think you wanted a scar?
Yeah.
So sad.
Yeah, that's horrible. That's horrible.
So sad. So he came in, he wants to be screened. He wanted to make sure that he doesn't have prostate cancer or other cancers, and we're going to check on his pituitary also. But it's really something important. If you have change in your vision, get checked out. It may be more than just simple things like glasses.
Yeah.
So the pituitary gland is a gland that can cause problems to the vision or other problems. In women, it can cause menstrual problems. In men and women, it can cause growth problems and sexual problems. So we do treat a lot of tumors, benign in the brain, like pituitary, acoustic neuromas, meningiomas, and also cancerous tumors in the brain. We had a patient came to us from Cuba this week.
Cuba.
What do you think about that? Cuba.
90 miles from Florida.
90. So it could be pretty, quite a story, right?
Yeah.
The Cuban story is quite a story. So this man knew Castro, actually.
Okay.
He had met him in the past, and he came to us with a lack of hearing. He was losing hearing in an ear.
Right.
And he investigated all the options, surgical options, and different kinds of radiation. And he did all that for months before.
Yeah.
So rather than just coming in and say, what would you do to your son, Doc, he investigated himself.
He did his homework.
He did his homework.
Yeah.
And we actually have the largest experience in the world treating acoustic neuromas with fractionated radiosurgery, which is non-invasive treatment, no cutting, no bleeding. He's here with his girlfriend, who's super beautiful and super nice and super supportive. He's in New York City. He came to us on Monday and started treatment this week. The success rate for acoustic neuromas is about 97%. Unlike surgery, most likely he'll keep his hearing and keep his balance and keep his face. He's really eager to get his treatment and eager to get better. We talked about follow-up. So we have the world's largest experience treating a brain tumor called acoustic neuroma with fractionated radiosurgery, non-invasive treatment. He was shocked about the treatment. It was so nice. He lay down, had the treatment, he got up, and he didn't
feel anything.
Nothing bad.
Good.
He was so happy, and his girlfriend was so happy and so supportive. So, again, if you have a tumor of the brain or the body, get the second opinion first.
I think the moral of the story is if you have any questions or concerns,
call us at
give a call.
212 Choices. We're here all week. We're here all weekend. We have a booklet of information to mail to you. We mail it at no charge.
Yep.
And the best thing is really make an appointment. It's really important just to come, call us in, make an appointment, come visit. Let's spend an hour, go over all your documents, meet in person, and you'll have all your questions answered. You'll understand us, we'll understand you, and most likely you'll have a better result.
Yeah, it's I can't stress that enough. It's always worth picking up the phone.
So call us at 212 Choices, 212-246-4237. We thank you all for listening. Thank you, John.
Yep.
Thank you all for listening. We'll be back tomorrow on 7:10
Thanks for
Radio.
tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Dave Packer. One more barrier to construction of the Keystone XL pipeline bringing oil from Canada to the Gulf Coast has been